Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to this week's episode of the Hope Natural Health podcast. Last week, we talked all about signs that you might need to hit the reset button on life. So if you're feeling this way, take a listen to that. I point out several different signs that you might need to hit the reset button. And now we're going to talk this week about different birth control options. And I want to start off by saying that there is a time and a place for birth control. I understand that with the new legislation and the new guidelines in all the different states, which I can't even keep up with, that birth control is, on top of mind for a lot of women. And you have options. You need to figure out what option is best for you. But I also want to say that birth control should not be used to fix your period. So if you're on birth control because you have a crappy period, this is something that I would love to discuss more further with you because it's really not fixing anything. So on the original part of this, there is a time and a place for birth control, and it's used to prevent pregnancy. So if you're wanting to prevent pregnancy and not get pregnant, I'm going to share with you the different options that you have. So first, we've got some hormone methods. So we have the pills, and we have a combination pill, we have a progestin-only pill, and we also have a continuous pill, which sometimes they consider that like taking it all the time so you don't have a period. So the combination pill will actually contain synthetic. Remember, the pill has synthetic hormone. The synthetic hormone is also linked to some other side effects that you might not be aware of. Low libido, anxiety, depression, vitamin deficiency, gut disturbances, weight gain. So keep that in mind. But the combination pill has synthetic versions of estrogen and progesterone, which is taken orally. And they are most effective if you take them on the same time of the day. So making sure that that is something that's of a habit for you. There's monophasic pills, which have the same amount of estrogen and progestin. Progestin is the synthetic form of progesterone. Biphasic changes the level of estrogen and progestin one time during the active pills and the level of progestin increasing in the second half of the pill. So that's actually like trying to mimic our natural cycle where progesterone, your natural progesterone, should be elevated on the last half of the cycle. But again, they're using the synthetic form of the progestin. And then there's the triphasic pills, which change the levels of hormones 3 times during the cycle. And both the estrogen and the progesterone level may change. So those are the 3 types of the combination pill. Then you have the mini pill, which is the progestin-only pill. This only contains the progestin hormone. And then there's also the depot shot, which has progestin in it, which lasts 3 months. When someone is on the depot, they typically don't get a cycle either. The patch is also another option. So this one does release hormones, and it's worn on your skin. And then the vaginal ring is another ring that is inserted into the vagina that can release the hormones to protect the pregnancy. So those are the hormonal forms of birth control. There is one other hormonal form, and that would be the IUD, but that's actually considered a long-acting reversible contraceptive. So the intrauterine device, or the IUD, it looks like a little anchor or a T-shaped device that's inserted into your uterus. And you can get hormonal and non-hormonal varieties. So the non-hormonal variety, there's only one in it, as far as I know, and that's called the Paragard or the copper IUD. And the hormonal ones would be like Mirena, Liletta, Skyla, Kylena. Those have progestin in them. Then we also have the barrier methods, which would include the condoms. So we have the male condom, which is worn over the man's penis to prevent the sperm from entering the vagina. There is actually a female condom, which is a little pouch that can be inserted in the vagina to provide a barrier against the sperm. And then there's the diaphragm, which is a little cup that's inserted into the vagina that covers the cervix, so nothing can get through there. If you're considering some more permanent methods, you can consider tubal ligation, which is a surgical procedure for sterilization in women, which can block and seal our fallopian tubes. And then for men, there's the vasectomy, which involves cutting and blocking of the vas deferens in the man. And say you don't want any of this and you want to choose some more natural methods. This is probably my preferred way of preventing pregnancy, and you can do that by many different fertility awareness-based methods, such as tracking your cycles, tracking your basal body temperature, tracking your cervical mucus to identify your fertile and non-fertile periods. And why this is my favorite is because it really teaches you a lot about your body and what is happening during your menstrual cycle, because again, everybody and every body is different. So it's super important for you to be in tune with your own body. And if you understand that there's really only 5 or 6 days out of the month that you can conceive, that's like the window is not that big. So if you understand when that is for you and you use, say, a non-barrier method like a condom or abstinence or even withdrawal, it is actually considered a method, the pull-out method. Your chances of getting pregnant are very slim, but I love helping women understand about their own body. So that's why I love these methods of fertility awareness and more natural prevention. You can also check out my period productivity planner so you can track your own cycle and notice your fertile days. There's tons of different apps for you to track. One of my favorites is the Natural Cycle app. You can pair this with an Oura ring if you have that. Or if you don't, you can just use Natural Cycles by itself, but it tracks your basal body temperature, and it's pretty darn accurate. So it'll tell you your caution days and be, alarmed or aware that you could get pregnant until you actually have that day of ovulation that you know of. So just to go back on the 5 to 6 days, it's the egg that you drop if you ovulate is really only viable for 24 hours. But sperm can live inside of the female body for 5 days. So that's where they get the 5 to 6 day window. So, you can have intercourse 3 days before you ovulate and still conceive. You can have intercourse 5 days before you ovulate and still conceive. And you can have intercourse the day after you ovulate and still conceive. So knowing when you ovulate and when you drop that egg is so important. Plus, more than just that, like you can use these beautiful hormones that are elevated during ovulation, like estrogen and testosterone, to work for you. This is your time to shine. This is your time to record podcasts, to go show up on social media, ask for a raise, etc. So you can, if you understand that, then you can use your hormones to work for you. So I just wanted to provide some insight on the different forms of birth control. And ways, and also, not only the tubal ligation, but you can have the hysterectomy, etc. That would be another one in there, more, more invasive and, something that's very permanent, where the vasectomy for men can be reversed. So keeping that in mind. But again, I'm a firm believer in helping you understand what's going on with your cycles. So consider the natural methods. It's really not that daunting. It's not that overwhelming, and you will learn so much about your body. So if you have any questions about this, feel free to reach out. This is my jam. I love educating around this topic. So I hope that you found value in this and learned something, and I look forward to seeing you all next week.